According to the Manipulation Committee in 2003, thrust joint manipulation is a high-velocity, low-amplitude therapeutic movement within or at end range of motion. Although thrust joint manipulation has been provided by physical therapists since the inception of the profession, and physical therapists have published the majority of the research to demonstrate its effectiveness, the chiropractic profession has mounted legislative and regulatory strategies to prohibit physical therapists' use of these procedures. Despite chiropractic use of patient safety and education as arguments against physical therapists' use of thrust joint manipulation, it is quite evident the primary purpose of this legislation is driven by economic motives. We will discuss the history of manipulation, the legislative challenges we are facing, and the battle between chiropractors and physical therapists that began in the 1960s.
In 1895, chiropractic was founded by D.D. Palmer, who actually stated that chiropractors do not manipulate, they adjust. Their philosophy was that adjusting the spinal subluxations would restore nerve flow and stimulate healing. They claim that manipulation is their own and that any professionals that try to do it are just infringing. PT practice dates back to 1813, where Per Henrik Ling of Sweden founded something called the Royal Central Institute of Gymnastics, where practitioners came from all over Europe to learn PT techniques. He actually named it this because the Swedish translation for physical therapy is gymnast of the sick. In 1925, Mary McMillan, the president and founder of APTA, actually stated that manipulation was in the PT scope of practice. Two PTs that advanced the use of manipulation throughout PT was Freddie Kaltenborn and then Jeffrey Maitland. Kaltenborn was known for relating arthrokinematics to manipulation, and then Maitland was known for his oscillatory techniques. Currently, evidence states that manipulation and exercise are PT's most useful tools. As PTs, we provide skilled intervention, and therefore we will not let down the fight to keep manipulation in our scope of practice.
Initially, the challenge against physical therapists was started in the 1960s, but has intensified since the 1990s, when our profession began moving towards direct access and doctoral education. Evidence of the National Chiropractic Agenda was witnessed heavily in 2003 and 2004, when many states encountered the same legislative challenges. In 2003, they focused primarily on education-based prohibition of manipulation. In 2004, they moved towards a flat-out prohibition, attempting to ban all physical therapists from doing manipulations in their practice. Seeing as physical therapists have been established as the biggest competitive threat to chiropractors, the primary motive behind these legislative challenges appears to be economical, although they claim that PTs lack the educational training to practice manipulations, that it is outside our scope of practice, and that patient safety is at risk when PTs perform manipulations.
I'm going to discuss why physical therapists are qualified to perform thrust and non-thrust joint manipulations. CAPTE evaluative criteria requires physical therapy schools to teach thrust and non-thrust manipulations. Physical therapy schools emphasize movement sciences and analysis, including anatomy and biomechanics. This provides a foundation for clinical decision-making skills needed for thrust manipulations. Schools train physical therapists to recognize red flags to perform or not to perform manipulations. Physical therapists are part of a healthcare team and are trained to refer patients to other medical professionals when needed. The physical therapy licensure exam is in place to assure that physical therapists practice within their scope of practice, including thrust and non-thrust manipulations. Studies have shown that less than 2% of adverse events from thrust manipulations, specifically cervical manipulations, have been caused by physical therapists, none of which have led to deaths. The U.S. Department of Health and Human Services is just one physical therapy agency that has determined that thrust joint manipulations are within the physical therapy scope of practice. In conclusion, as long as physical therapists use clinical decision-making skills, they have the proper training to perform thrust and non-thrust manipulations.
As aspiring physical therapists, licensed physical therapists, and physical therapy assistants, we must take action to protect our profession.